As we get older, protecting our hearts becomes more important than ever. But what if the biggest danger isn't your diet, your stress, or even your genetics? What if it's sitting quietly in your medicine cabinet? Today, leading cardiologists are sounding the alarm about common pills many older adults take every day without realizing the risk. We're talking about medications that are FDA approved and doctor prescribed. But in aging bodies, they can quietly increase your risk of heart failure, stroke, or sudden cardiac events. The worst part is that most seniors never get warned. Prescriptions get renewed automatically, and side effects are mistaken for just aging. Dangerous combinations are too often overlooked. But that changes today. In this video, we're counting down 5 pills that can damage the hearts of older adults, especially after the age of 60. Some of these you may recognize, while others might surprise you. Every single one of them deserves a second look. This isn't about fear. It's about facts backed by research and explained in plain English. If you're over 60 or care about someone who is, watch closely. What you're about to learn could protect your heart, your independence, and maybe even your life. Before we dive into the 5 medications that could be straining your heart, hit subscribe so you never miss an update. Let's begin with number 5. It's in almost every home, and it may be quietly increasing your risk of heart failure and fatigue. Ibuprofen and NSAIDs are the hidden strain on aging hearts. Ibuprofen, naproxen, and diclofenac are painkillers found in nearly every household. They're trusted, familiar, and easy to find for arthritis or a stiff back. But after 60, these common pills can quietly become a serious risk to your heart. NSAIDs do more than relieve pain. They also affect how your kidneys manage salt and water. In younger adults, the body usually adjusts to these changes. With age, kidney function naturally declines even when lab results look normal. That decline means your body may begin retaining extra fluid. You might notice swollen ankles, tighter shoes, or a heavy feeling in your legs. You may feel more tired by the end of the day. These symptoms are often mistaken for aging, but they are often warning signs. Fluid retention increases the workload on your heart significantly. For older adults with high blood pressure, that added pressure can lead to worsening heart failure. The risk doesn't stop there. NSAIDs can also reduce blood flow to the kidneys, weakening them over time. They've been linked to elevated blood pressure and even increased risk of heart attack. The longer you take them, the more those risks add up. Even short-term use can be risky when combined with other medications. Combining them with diuretics or AC inhibitors creates a dangerous trio. This can severely impair kidney function and increase heart strain. What makes this so dangerous is how subtle it all feels. You won't feel your kidneys struggling or your heart working harder. The symptoms like swelling and dizziness are easy to dismiss as just getting older. Because they are over the counter, they don't seem serious. If you're taking NSAIDs regularly and you're over 60, it's time to talk to your doctor. You may not need to stop them completely, but using them occasionally makes a big difference. Safer options like acetaminophen or topical treatments might be better for you. Lifestyle approaches like stretching or heat therapy can also help manage chronic discomfort. The goal isn't to suffer in silence. It's to treat pain without creating a bigger problem. Now, let's move to number 4. It's not a painkiller for your joints or your back. It's something often prescribed to help you sleep or calm anxious thoughts. Number 4 is benzodiazepines, the sleep aid that can steal your stability. If you've struggled with falling asleep, Your doctor may have prescribed something like lorazepam or diazepam. These medications feel like a lifeline for many older adults. They help you sleep through the night and take the edge off anxiety. But what if that same pill was quietly increasing your risk of falls and confusion? Benzodiazepines work by slowing down activity in the brain and nervous system. In older adults, that same effect can go too far. These medications slow reaction time, muscle control, and balance. That combination increases the risk of falls, especially during the night. Falls are a leading cause of injury and loss of independence in seniors. The danger goes deeper than just physical accidents. Benzodiazepines are also linked to memory issues and a higher risk of dementia. What starts as mild forgetfulness can gradually progress over time. Most people never trace these issues back to the medication. Then there is the serious issue of dependence. Your body adjusts to these pills, and you may need more to get the same effect. Stopping suddenly can trigger withdrawal symptoms like tremors and insomnia. It becomes a cycle where you need the pill to sleep. But the pill may be damaging the stability that sleep is meant to support. So what should you do? First, don't panic and don't stop the medication suddenly. Talk to your doctor about a slow, supervised taper or safer alternatives. There are non-drug therapies that actually work. Cognitive behavioral therapy for insomnia is one of the most effective treatments. For anxiety, approaches like mindfulness or light exercise can be very helpful. Not all sleep or anxiety needs a heavy sedative. For older adults, a small dose of relief can come with a high cost. That little white pill might be pulling away your balance and awareness. If you found this helpful so far, take a second to like and subscribe. Now, let's move on to number 3. Number 3 is proton pump inhibitors, the silent drain on your heart and body. Heartburn and acid reflux are more common as we age. For many, the solution is a pill like omeprazole or pantoprazole. These medications work by reducing stomach acid and feel like a miracle. No more burning chest or pain after meals. But these pills were never meant to be used long-term. Millions of seniors take them for years without re-evaluating the need. Over time, that quiet routine can come with serious consequences. One of the most overlooked effects is how they interfere with nutrient absorption. Stomach acid helps your body absorb calcium, magnesium, and iron. When acid levels stay too low, those nutrients don't get absorbed properly. Low calcium means weaker bones and a higher risk of fractures. Magnesium deficiency can affect your heart rhythm and cause muscle cramps. Low iron and vitamin B12 can cause anemia or mental fog. These issues look like natural aging, but are often medication-related. Stomach acid also protects you from harmful bacteria. When it's too low, you become more vulnerable to infections like C. diff. Some studies even link long-term use to kidney disease and dementia. The longer you take these without review, the more risks outweigh the benefits. That doesn't mean these pills are bad. They are effective and necessary for active ulcers or specific conditions. But what should be temporary often turns into a permanent habit. If you've been taking one for months, talk to your doctor. You may be able to switch to a lower dose or taper off. Relief today shouldn't come at the cost of your strength tomorrow. Now, let's move on to number 2. This medication is supposed to protect your heart. Number 2 is heart and blood pressure medications when the cure becomes the risk. These pills are supposed to lower pressure and reduce strain. For millions of older adults, these medications are essential. But the same medications prescribed to protect you can also put you at risk. This happens if the dose is too strong or the combination is too complex. Let's start with diuretics, often called water pills. These help the body release excess fluid and salt. In older adults, they can lead to dehydration and potassium imbalance. That dizzy feeling when you stand up might be your water pill. Then there are calcium channel blockers, which relax blood vessels. In some seniors, they cause leg swelling or slow the heart rate too much. Beta blockers can also be tricky for aging systems. They slow the heart rate, which is helpful, but sometimes it's too much. This can cause shortness of breath and reduced exercise tolerance. The body changes dramatically with age as vessels stiffen and kidneys slow. A dose that worked at 55 may be too much at 75. Many older adults are prescribed multiple heart medications at once. This is called polypharmacy, and it's incredibly common. One medication leads to another to balance out the side effects. Soon, the body is juggling 6 or 7 different prescriptions. You start to feel foggy, weak, or less steady. You might assume it's age, but it's often medication overload. When these pills interfere with balance, the risk of hospitalization goes up. These medications can be life-saving, but they need regular evaluation. The goal is to stay sharp, steady, and independent. Ask your doctor if your doses are still right for you. The right medication can save you, but the wrong combination can steal your vitality. Now, it's time for number 1, the most dangerous pill of all. It is not a single pill, but rather the total combination. Number 1 is polypharmacy, where the most dangerous pill is all of them. Taking 5 or more medications at once is a major threat to senior health. It's shockingly common in adults over 65. One pill leads to another until your body is juggling a complex mix. These drugs were often never tested together in aging systems. Every new medication increases the chance of side effects. Every combination raises the risk of harmful interactions. Every extra pill makes it harder for your organs to keep up. The effects are subtle, like feeling tired or forgetting things. Most people assume it's just part of getting older. Sometimes it is not aging, it is just the pills. Many of these prescriptions are no longer needed. They were given years ago and never re-evaluated. Sometimes the side effect of one drug is being treated with another. This creates a spiral into fatigue and frailty. Polypharmacy doesn't just strain your heart, it steals your energy. The solution isn't to stop everything, but to review everything. A skilled doctor can help identify outdated medications. Reducing what is unnecessary can be life-changing. You might find you have more energy and a clearer mind. Health isn't always about adding more. Sometimes it's about letting go of what doesn't serve you. If you are on 5 or more medications, schedule a review. Ask the hard questions and advocate for yourself. The most dangerous pill might be the one you don't need anymore.